Today, we are going to talk about what is dyspnea. So, what is dyspnea? Dyspnea is a condition of a difficult or labored breathing, wherein it is a pathologic event that may occur for the following basic reasons. Number 1 is the need for additional oxygen, wherein lack of adequate oxygen can be caused by either diminished oxygen in the environment, disorders interrupting the transfer of oxygen, or a decreased oxygen carrying capacity in the blood. Another reason is for the compensation for metabolic acidosis, wherein when compensation for metabolic acidosis is present, it involves the blowing off of carbon dioxide through the lungs and may cause an increase in both the rate and depth of respiration. Another is excessive environmental heat, or what we know as heat stroke, wherein we know that dogs and cats dissipate heat through the respiratory system by panting. Therefore, an excessively hot environment may cause labored breathing. Another is the damaged or diseased central nervous system. Any disorder causing damage to the CNS may disrupt control of breathing and causes dyspnea. Another reason is the weakness of respiratory muscles or dysfunction of the motor nerves of respiration, wherein conditions such as polyradiculoneuritis or diaphragmatic paralysis causes a labored breathing. And another one is the pain from structures involved in breathing. Any pain in the structures involved in breathing causes dyspnea. Pathophysiology of dyspnea. There are three main components contribute to dyspnea. These are the central information processing, afferent signals, and the efferent signals, wherein the central processing in the brain compares the afferent and efferent signals, and dyspnea results when a mismatch occurs between the two. There are a lot of causes of dyspnea, and localizing the cause is very important. Number 1 localization is the upper airway, wherein this is an inspiratory type of dyspnea which is characterized by a prolonged, labored inspiratory effort and a quick, relatively easy expiratory phase. Another localization is the lower airway, wherein it is an expiratory type of dyspnea characterized by both inspiratory and expiratory dyspnea with a rapid respiratory rate. Another type is the restrictive type of localization, wherein there is a rapid shallow type of dyspnea characterized by both inspiratory and expiratory dyspnea with a rapid respiratory rate. And the last type of localization is the miscellaneous type, wherein there is a rapid shallow or deep type of in diagnosing, history and physical examination is very important. It could determine if the disease is acute or is sudden in onset, or either it is chronic or is slowly and progressive onset. Either it is acute or it is chronic, laboratory evaluation would help to further diagnose the disease. Laboratory evaluation includes radiography to determine its location if it's obstructive or other. Another is cytology to determine if obstructive fluids is caused by fungal or bacterial infections. And another is electrophysiologic testing that is especially indicated if cardiac disease is suspected. After performing these certain procedures, a definite diagnosis could be made. There are certain diseases causing dyspnea in dogs and cats, and upper airway diseases includes stenotic nares, rhinitis, elongated soft palate, laryngeal diseases, laryngeal collapse, and hilar lymphadenopathy. Another disease is the lower airway diseases, which includes bronchial diseases, pneumonia, pulmonary edema, deep mycosis, and pulmonary thromboembolism. Restrictive causes includes pneumothorax, pleural effusion, diaphragmatic hernia, and others. Miscellaneous diseases includes obesity, pain, and heat stroke. Symptomatic therapy of dyspnea depends on what is the cause of its labored breathing. But as a first step, oxygen administration is done if patient arrives with dyspnea. After oxygen administration, localizing the cause is very important. Upper airway causes could be treated through surgical correction or medical therapy depending on its cause. Lower airway causes are mostly medical therapy with the use of bronchodilators and theophylline derivatives or other drugs. Restrictive causes, depending on its cause, medical therapy with diuretics and other drugs is used. Also, thoracocentesis and surgical techniques are used to correct restrictive causes. And that is all about dyspnea, and thank you for watching.